Hi, my name is Jody Barth. I'm one of the principal clinicians behind the Center for Facial Recovery and its nonprofit arm, the Foundation for Facial Recovery in Rockville, Maryland. Two schools of thought govern when to begin physical therapy treatment for facial palsy. Some practitioners advocate waiting until a patient has gone 3 months with little or no recovery. Others find benefit in having a patient begin physical therapy immediately to receive in-depth education, guidance, and treatment. Those of you who just developed facial palsy may wonder, why start physical therapy if there's a chance I will be one of the roughly 70% of people who fully recovers? Our clinical findings indicate early intervention promotes better outcome for those who find themselves in the 30% of the facial palsy population with delayed healing and slow recovery. Since it's difficult to know at onset which category you will fall into, we believe seeing a facial palsy physical therapist early is the optimal approach. It's important for you to understand where your symptoms originated. This will allow you to better understand the mechanisms behind the many complications that can develop and how healthcare professionals with experience treating facial palsy can partner with you and each other to improve your recovery. The seventh cranial nerve, also called the facial nerve, controls the vitally important mimetic muscles that generate facial expression. Facial muscles are unique in that they are the only muscles in the body that have voluntary and involuntary activity. These muscles convey our emotions and help us communicate with other people. If you don't have this ability, it can understandably be very upsetting. Facial muscles are also distinctive because most of them insert into skin or fascia rather than bone. In this diagram, you can appreciate that whatever is happening to the skin directly impacts the muscle's ability to function. Small and delicate, the facial muscles are susceptible to contracture, tension, deformity, and weakness. This is the reason we recommend gentle massage and stretching at onset. Until now, your seventh cranial nerve was able to send a vital movement, triggering signal from the brainstem to the facial muscles. But now something has triggered inflammation in the nerve on one side of your face and caused it to swell inside the narrow, bony canal encasing it. This compression interferes with the nerve's job, which is to deliver chemical agents called neurotransmitters to the muscles to power them to move. When the nerve is inflamed and swollen, the muscles don't receive the chemical response they need to activate. Muscle activity is weakened or halted, producing the facial paralysis, asymmetrical features, and functional problems you are experiencing now. As you can see, the 5 main branches of the facial nerves have many smaller branches, each connecting to very specific areas of muscle. This is one of the reasons why we do not advise electrical stimulation, because it broadly distributes current, causing muscle contraction in other muscles than those intended. If you have pain in front or behind the ear, you develop noise sensitivity, ringing in the ear, hearing loss, and/or dizziness, other cranial nerves besides the seventh or facial nerve may be affected, especially the trigeminal nerve and the vestibulocochlear nerve. In our clinical experience, if you have or experience these symptoms, you might be more likely to be in the 30% of the population who will experience a slower recovery, and your symptoms may not be due to Bell's palsy, but due to either Ramsay-Hunt syndrome or Zoster-Sinn-Herpeti. This is an important conversation to have with your clinician. Thank you for watching. For further information, check out our book, Fix My Face, or email info@facialrecovery.com.